The boy was torn off and hit on the neck, causing heavy bleeding. A passing doctor rushed forward to give him first aid and used a piece of cloth to press the wound to stop the bleeding. However, a teenager nearby only took a look and immediately pointed out that the doctor was going to kill the boy. The teenager continued to explore and found that there was a piece of glass tied to the boy's stomach. He spread out the boy's arms and observed his veins. This was a picture of the human body structure in his mind, which he quickly diagnosed. The boy's left lung was damaged. It would not be long before he could pass the security check without a knife. The teenager had to let the doctor do his job first. The doctor looked at him and snatched the detained knife without saying a word. Then he ran towards the boy with a strange look. Fortunately, the boy's mother explained in time. This is how the subsequent surgery was performed. Finally, the catheter and knife were placed in the boy's lungs, and the other end of the catheter was inserted into the lungs. The accumulated gas was discharged, and the boy's life was temporarily suspended. The onlookers were also excited about this unusual operation. One of them said that he was talking nonsense. It started to rain. It seemed that Shaun was just considering that everything was easy to start. If it was an operation, the doctors present could not believe it. A piece of information was just a piece of information. We were the last piece of information, but it was not a piece of information. A glass was taken out, the boy's crisis was solved, and the hero Shaun got a chance to be hired as a surgeon. When Gao asked him why he wanted to become a surgeon, he asked him to deal with more difficult and complicated cases in the next few days. On the surface, it was to accumulate experience, but those were all thankless jobs. However, Shaun began to take care of the patients with all his heart and responsibility because he was worried about himself. The passive effect of the brain was effective, so he prescribed dozens of tests for each patient. For example, this brother just had water in his ears, so he asked the nurse to open a box of resonance for him to see his brain. As a result, the brother was very lucky. He had only a little problem on his body. He didn't waste a lot of money. At this time, he turned his face away and pulled her aside and scolded her. Although the girl was discharged from the hospital, Shaun was very stubborn. She even paid for the girl to do the test out of her own pocket. The final result was in the evening, and her expression became more and more severe. He ran out of the hospital immediately and rushed to the little girl's home in the early morning. He knocked on the door hard. The girl's father warned Shaun that he was disturbing her. Sure enough, Shaun's ruthless words completely angered the other party. She denounced Shaun as a freak and closed the door. But Shaun still knocked on the door again. The girl's parents were finally shocked by Shaun's words and had to lead her in. At this time, they found that the girl had been lying in bed unconscious. They drove the girl to the hospital. Shaun gave the girl CPR on the way and took her to the hospital. Shaun used ultrasound to examine the girl. He just looked at it and hesitated. But Shaun didn't care. So many lives were the most important in his mind. Thank you. Shaun expressed his worry that his outspokenness would hurt others again, but in the end, the dean said after much encouragement, Shaun finally mustered up the courage to accept the embrace of his parents. In the end, his companion inserted the clamp into the blood vessel and indeed clamped a pellet of gel out of it. Then he took out a drink, absorbed alcohol, cleaned it, and inserted it into the liver. He then injected a solution that could maintain cell activity. In this way, the liver came back to life. Fortunately, this liver got a suitable liver, but the location of the liver was far away in San Francisco. The liver only has 8 hours to live. If they want to go back to the hospital, they have to walk. They had no choice but to ask for a police car to escort them. But halfway through, they found that it didn't work at all. This is when Shaun noticed that the icy buckthorn next to him had been cleansing for 57 minutes. The liver was sent back to the hospital. However, at this time, they learned bad news. The liver could not be transplanted. It was not because they did not confine themselves to the hospital. After they were freed from confinement, they had other people, and the liver was eventually handed over from Shaun and his friends to someone in another hospital. Shaun's companion was obviously a little disappointed. She used this clumsy way, and her companion finally wanted to share. In any case, their efforts along the way were not in vain. The last one is in this movie, and the last one is in this operation. If she got infected, Neil still chose to accept the operation. But her husband got angry when he heard it. He said, "Move, move. Continue the operation. She doesn't care about her own life, she just wants to give birth to this child." This time, the pregnant woman's husband also supports her idea. The deep feelings between the couple made Miller speechless for a while, and also moved the intern Dr. Xiao Shuai who was beside her. In order to save the mother and child, Xiao Shuai read medical books overnight and found a way. She told Zongyuan about the idea. They could stop the pregnant woman's heart from beating first and then install an external implant. The external heart muscle was a risky move. No one was sure it would be 100% successful. However, the couple accepted this plan without hesitation. The operation started again. They put a machine on the pregnant woman. The pregnant woman immediately determined that the boy had a brain problem through the tremor of her eyeballs. Shaun sent the boy to do an MRI. The boss scolded Shaun harshly for his actions, but Shaun insisted it was probably a stroke. He explained the situation, and the boy's parents finally learned the bad news. They were relieved soon because, after several examinations, they knew the boy would face the judgment of death sooner rather than later. This made Shaun very unwilling. He made up his mind to save the boy. The cure rate was lower than the probability of winning the lottery. Just when Shaun was at a loss, a medical record gave him a clue. He began to think that he needed to do a bone marrow puncture on the boy, but Neil ruthlessly rejected her idea. Because the boy's girl was immediately sent to the operating room, the doctor removed the embolism of the boy's artery. The operation went very smoothly, but Neil also found through this operation that the cancer cells had metastasized. The 3 probability guess was declared shattered. Shaun's face was expressionless. Finally, Shaun took out a book in front of the boy's bed. It was a gift from his deceased brother. It was his brother who inspired Shaun to become a surgeon. In a second, a large number of wounded people poured into the hospital. It turned out that a nearby wedding bus had crashed. Each doctor had to treat the patient sent in according to the label. The wounded person assigned to Shaun was a man with a comminuted fracture of the thigh. At this time, Shaun quickly held down the wounded man, but this was not a solution. Shaun was visibly frustrated. His brain started to work quickly. In a fraction of a second, he thought of a way to save him. Confidently, Shaun stabbed him in the thigh. As soon as he let go, the blood stopped burning, and the blood pressure returned to normal. The other doctors praised his quick thinking. However, the man's leg was still in a critical state. They were now left with 2 choices. One was the safest option, but it came with long-term complications. The second plan was riskier but offered a chance for complete recovery. The man's parents rejected the second plan on the spot, unwilling to take the risk. Both sides held differing views. As the argument continued, Shaun suddenly lifted the quilt and exposed the man's legs. Upon further inspection, he discovered the issue lay on the other side. Shaun explained his findings, and finally, the lawyer present made a fair statement. Shaun proceeded with the surgery. As he connected the leg bone to the man's thigh, the electrocardiogram showed no abnormalities. The operation went very smoothly. However, when the man woke up from his coma, Shaun asked him to move his toes, but the man felt nothing. Did the operation fail? The reaction proved that the man's legs were gradually shrinking. This devastated the man, who hoped to recover fully. Meanwhile, the hospital faced another challenge, a difficult patient who refused treatment. Only Shaun, with his unique perspective as an autistic doctor, noticed something others missed. Shaun wanted to take the child out of the hospital, but the conditions diagnosed by Shaun did not yield a simple result. Shaun directly held the boy's hands. To everyone's surprise, the boy began to recite a series of mysterious numbers. Shaun, also autistic, understood the meaning instantly. It was an example of how autism brings remarkable attention to details. Using this understanding, Shaun calmed the boy down, who seemed to overreact to stimuli. Shaun noticed the boy was fascinated with specific techniques, and he used this interest to engage him repeatedly in the ward. However, if nothing unexpected happened, this film would be the last. The last film was a constant topic of discussion among the team. With all options exhausted, the only procedure left was laparoscopic exploration, which could only be used as a backup. The boy was visibly upset when he heard he had to return to the hospital. His belly was pierced, his expression tense, and he began talking nonsense. Yet, despite his condition, he looked at Shaun as if seeing a role model. At this moment, Shaun noticed a clue. The boy's red face was a sign of ocular pigmentation. Shaun quickly diagnosed that the boy had likely eaten something improperly cooked, which had paralyzed his digestive system. Fortunately, surgery wasn't required, but Shaun had to work hard to earn the trust of the team. Many still harbored stereotypes about Shaun's autism, fearing that he might lose control during an operation and cause its failure. Even Neil, a conceited doctor, had to admit Shaun's accomplishments, though he initially doubted Shaun's capabilities. Shaun faced a tough reality. If his colleagues didn't trust him, they might suggest transferring the boy to another hospital. But as long as the boy remained here, Shaun would not leave the surgical team. As Shaun entered the ward, he expressed gratitude for the boy's trust in him. Suddenly, the boy's condition worsened, and immediate surgery was required. In a pivotal moment, Neil personally handed the scalpel to Shaun, finally acknowledging his skill. When the operation began, Shaun pointed out that ITAPSENAYA reported damage to the boy's abdominal cavity, which could have caused a fatal outcome if left unchecked. Fortunately, the issue was caught in time. Several doctors worked together to remove the poison and cyst. Though unexpected events occurred during the surgery, it was ultimately a success. Shaun, reflecting on the experience, advised the boy's parents not to spoil him. Autism, Shaun said, doesn't prevent a person from growing up independently. The parents took his advice to heart and resolved to let their son make decisions for himself. Later, Shaun encountered an unrelated incident at the supermarket. A robber held him at gunpoint, ordering him to raise his hands. Shaun complied but remained composed, not reacting to the robber's aggression. Meanwhile, Shaun's calmness continued to inspire others. Despite facing accusations and hostility, he stayed focused, showing unwavering dedication to his patients and his principles. Later, Shaun went to the ward for a checkup and encountered the boy again. The boy's mother was still blaming Shaun for earlier complications, but Shaun remained focused on the task at hand. He examined the boy's condition, noticing signs of weakened muscle. Meanwhile, a critical case involving a girl demanded immediate attention. Shaun's skillful techniques helped stabilize her heartbeat momentarily, but it became evident that this was only a temporary solution. Benil asked the nurse to prepare medication while the doctors discussed the girl's deteriorating condition. The team proposed a bold hypothesis: the girl's rapid decline might be due to unnoticed internal bleeding. Realizing the urgency, they prepared for another surgery, even though the girl's weakened state made survival uncertain. As they deliberated, alarms sounded, indicating her condition was worsening. With no time to spare, they rushed her into the operating room. Following Shaun's guidance, the team located a bleeding point on the torn artery and successfully stopped the hemorrhage. After stabilizing her vitals, the operation was deemed successful. The girl's parents, who had just arrived, were finally informed about the procedure. The girl, showing remarkable resilience, began to regain consciousness. Witnessing this, Shaun quietly exited the room, but the girl called out to him, acknowledging his efforts. However, her recovery wasn't smooth. Her heart faltered multiple times during the next phase of treatment. Attempts to stimulate the heart showed some improvement, with the rhythm stabilizing at intervals but failing to sustain. Shaun, known for his bold thinking, proposed a plan: a complex myocardial resection to address abnormal insertion points in her heart. Initially, Shaun's approach was met with skepticism, as it required multiple high-risk procedures to be performed simultaneously. However, Neil, swayed by Shaun's conviction, discussed the plan with the boy's mother. She initially hesitated, suspecting the hospital might be acting negligently due to their socioeconomic status. Yet, she ultimately chose to trust Shaun's judgment. The operation, a highly intricate 5-hour procedure, demanded precision. During surgery, adjustments to the heart were made, attempting to reduce abnormalities to 13 millimeters. Despite simulations showing promising results, the team faced challenges as the partial membrane supporting the heart proved insufficient. After numerous tests and adjustments, they managed to stabilize the heart for a brief period, but uncertainties loomed about the girl's long-term prognosis. In the end, the girl's survival hinged on both her physical resilience and the team's ongoing efforts. Shaun, as always, remained composed under pressure, determined to push the boundaries of his abilities to give his patients the best chance at life. When playing games, men swing too hard when playing games. He got himself disabled. Coincidentally, the doctor was Shaun. He asked the man to hold his hand. However, since everyone came to find Shaun, he couldn't say anything. But when he was leaving, the man called Shaun. It turned out that the man was a world-class e-sports player. He believed that the key to winning in the game was not to follow the crowd but to stop. But his long-term lack of self-confidence did not allow him to change immediately. Soon, the operation began. The doctor cut and began a lifetime of cutting. Started a life like this: everything in the end, everything must be used to remove all difficulties for their own judgment, and other words must be used to avoid playing games. Then, you must have the courage to remove all difficulties for your own judgment. Desire, however, can only be brave and against evil. The test results came out very quickly, and the facts also proved that the man actually concealed that he had once suffered from cancer, but he was cured at that time, so he didn't care anymore. It was dangerous to have his central nervous system cut off. Even if the operation was successful, he would still be paralyzed, which meant that he would never be able to play again. The man did not lose heart after learning about his situation, but was happy. The operation was performed by the dean. As the most skilled doctor, he easily cut off the tumor on his head. But just when everyone thought everything had begun, you asked Shaun for his opinion. Shaun said, after looking at the stiffness of the whole body, Shaun concluded that the problem was no longer in the brain stem but a malignant high fever caused by the anesthetic. So Shaun found the man after he woke up. At this time, the left side of the man's body had completely lost all sensation. Shaun felt that he might not be able to play games in his life, but the man said that he would have to wait another 6 months before he could continue. The brain bag separation operation went relatively smoothly. The two sisters lay on the bed and began to imagine the campus life they were going to play. The sister suddenly fainted. The instrument showed that she had difficulty breathing and her heart rate dropped. The doctor immediately determined that this was a manifestation of heart failure. It would not take long. Now it has been reduced to half a day. The risk of surgery has also increased dramatically. However, in order to be able to wear the fashion they like, the two sisters came in and cut off her surgery. Only then was it officially announced that the surgery was successful. However, in the film after the operation, it has been started until the end. At the end, it has been the sister's heart failure. The problem of exhaustion was not completely solved, so Shaun once again made a shocking suggestion that he could kill the younger sister and save the older sister. The family had no choice but to sign the surgery agreement. The third time they were pushed into the operating room, the doctor unplugged the younger sister's breathing mask. Just when they were about to mourn, they used it. Then what else could be done to save them? At this time, Shaun's brain was cheating again. The two sisters were pushed into the operating room for the fourth time. This time, the doctors followed Shaun did what he said. When they came out of the operating room, the two sisters woke up. At this moment, Shaun realized that the elder sister's heart had been supplying blood to the two sisters' bodies, and the younger sister's heart was in a semi-disabled state, so she had a coma before. After 5 consecutive tosses, the elder sister finally couldn't hold on and stopped breathing in the operating room. Seeing this, the doctors had no choice but to transplant the elder sister's heart to the younger sister. The elder sister lives in the younger sister's body, supporting her to walk on the normal life track. The woman accidentally burned her hand while cooking, but the doctor was surprised. However, Shaun smiled. Seeing this, everything was very easy. The film was the same. The film must be a bomb. In order to verify the truth, the doctors put a lens on the girl and she also had inflammation. The film of inflammation was a blood test. They had to stop and wait for the woman to wake up. Shaun questioned her. Why did she hide her illness? However, the woman was hesitant to explain. The blood test results showed that the woman's blood contained methanol. Inflammation may come from the B part. Inflammation may come from the chemical bomb. Shaun came to the woman again and asked her if she was a terrorist. Now, if the doctor wants to cure the woman, he has two choices. Once the decision is wrong, the woman may be killed. Now the problem is thrown to Neil tried to fight for it again, but Neil had made up his mind. Another doctor gave the woman an antibiotic injection, but immediately the woman's physical signs showed abnormalities. Fortunately, Shaun reacted in time and replaced the rib lip with the rib lip. The woman's body was just as Shaun expected, so he stole some dimethyl sulfate paper to make perfume for the woman. Unexpectedly, this breath was not good. The boy said that he was a girl, not a boy. But Shaun was a straight man and he argued with him. In the biological sense, you are a boy. At this time, the others also realized that the last girlfriend asked him whether he would wear a skirt or not. If you don't wear a skirt, you must go to play in the movie. He kept shaking his head because when we told him that he would grow a beard and a throat if he stopped taking the medicine, the patient shook his head. He was still expecting a child to carry on the family line. The matter became a difficult family matter for the government to settle. The doctors had to withdraw from the ward. Later, the grandmother even took the parents to court for abuse. Treat children as they like and let them take hormones. That's why they want to become a girl. They think this is helping the child through the difficult times. Of course, the grandmother is firmly opposed to it. What? The child has no blood circulation. Surgery must be performed immediately. Now the host has to make a decision immediately. At this time, a doctor's way is it's the same, but everything about us is the same. Everything starts to play straight. The heart is taken out and put back in the correct position. However, she met the doctor, Shaun. Sure enough, after a round of examination, the problem came out. The girl's heart was larger than that of a normal person. The doctor explained the reason to the girl and asked her to wait for another 4 years. Everything would be easier after she turned 18. But the girl shook her head. She didn't want to endure the pain any longer. She had experienced the suffering of being beaten since childhood. She turned her head and looked at Shaun, who felt pity for her. Although Shaun showed that he was not moved, he was determined to risk his life for the girl. He expanded the girl's chest cavity so that the heart could be placed inside. Then, he cut off the chest muscles with an electric knife. The doctors agreed to proceed with the surgical plan. They were determined to cut the chest carefully with precision, ensuring no further complications. The tumor had grown significantly over the years, and the doctors worked together to come up with a plan for the couple. After careful adjustments, Shaun learned from the man's wife that she was worried. She feared that her husband, once recovered, might no longer need her. They had been together for so long, but her humility caused her to underestimate her importance to the family. With his wife's approval, the operation was carried out. Neil, however, had no intention of giving up and still insisted on using sperm preservation as part of the treatment. The surgeon's remarkable knife skills allowed him to remove all tumors in just 20 seconds, bringing the man back to life. When the man woke up in the ward, he realized the operation was a success.